First, the ADA disclaimer, as you've heard from everyone else, I do not have any financial interest of a product in my talk or with any companies offering grant monies for this continuing dental and medical education program. Dental insurance. That love-hate relationship that, yeah, I don't know. Well, your patients love it. We love to get the electronic payments. Yay, money in the mail, and then we do the write-offs, right? Let's talk about that. History of dental insurance. Depending on who you talk to, it's about the 1950s. Some people will say it started with the longshoremen out in Seattle. I really don't care. It's been around a long time. The reality is by the 70s, it was $1,000 a year of benefit. A person could get their entire mouth fixed for $1,000 in 1970. In 1970, I bought a new car for just a little over $2,000. So, you know, by comparison, that is half a car. Yes, I did. That is half a car. And the early plans really didn't distinguish between anything in network or out of network. I'm sorry, this is caught in my hair, so I'm just going to hold it here. The fees were average as usual and customary for your area. What an idea, huh? Because now, if you live in a very affluent area, they will meld your zip code with some other area, and, oh, that's a UCR? I don't think so. Preventive care was usually, if you've been in for a while, you know, for most plans, preventive care was 100%, minor services at 80%, major services, Crown and Bridge, at 50%. We all kind of knew the game. And boy, in the 70s, insurance just grew. I mean, it was a great deal. More businesses kept on coming on board. The auto industry came on board, and dentists got busy. I worked in a pedo practice then. We could not, we were bursting at the seams. It could not have been in a better time. Today, yeah. What does it cost your office to participate with any insurer? Because we all know UCR does not make sense. What benefits do you derive? How many dentists in your area are in network? So does it make sense for you anymore? Because the changing landscape of CMS Medicare Advantage is out to get you. Patients love it. We're going to talk about private contracts, why you need them, and what do you need to bill a patient's medical insurance. I also have a surprise in here just updated last month. So let's talk about first what it's worth to participate. Where do your patients find you? Does anybody keep track? Do you all keep track of where they come from? If they say internet, please delve more into that. Did you just Google search? I mean, just seriously, did you Google search holistic dentist? Or, you know, did you have a friend, something? Very, very seldom in this group will you hear anybody that say, you're on my list. Okay. How many patients come to you just because you're a network? If you're like a lot of us, your patients ask, do you take my insurance? But they don't come to you because you are on the list. And then how many dentists participate with that carrier? If most of your area participates with one particular carrier, I'm from Michigan. Delta owns more than 80% of Michigan. Everybody participates with Delta. I know that if I drop Delta, if they just want regular traditional dentistry, they can go anywhere. If they want what we offer, there's 5 offices in my state. Kind of limits their choices. Okay, so we're going to talk about the actual cost of participating. And it is considered, Delta will tell you as well as the other carriers, it's advertising. It's no longer R&D. We're giving you patients, but you've already said they're not coming to you because you participate with Aetna or Hancock or MetLife. And participating dentists are calling it dental insurance. Your patients are calling it dental insurance. What it really is a discount plan. It's Costco for your patients. And it does cost you. Question?
That's interesting. At our office, we differentiate between a benefit plan and a discount plan, and we never use insurance.
That is very good.
And the discount plan, we do tell patients it's just like Costco.
It is. It is very much like Costco.
For your card, and we get you toilet paper. With a discount plan, you pay $8 a month, and you get 20% off of all of ours.
And then what does that mean for the patient who doesn't have that insurance? They're paying more because that teeter-totter's got a balance at the end of the day. So how much write-off is okay? Anybody here ever do the math? It's scary, isn't it? So let's just take an example, porcelain ceramic crown, and let's just say for kicks and giggles that you charge $1,500. So let's say on average, because this is my office using examples, it costs about $500. You add the doctor's chair time, add your assistant time, add any lab materials, or if you're milling an office, I have CEREC. The CEREC blocks are not expensive. Who paid for the CEREC equipment? $75,000. Who paid for the milling machine? Another $60,000 to $75,000. Add all that up for patient use, your cost is relatively $500. Okay, that makes sense. But your fee-for-service patient pays $1,500. Okay? The managed care discount plan says, oh, we're going to write off, and if you have Delta in Michigan, you're writing off $480 something. There's the $500 from Delta and the $500 write-off. Oh, your profit is now reduced from $1,000 to $500. What if your equipment goes down? Where are you going to have the money to buy a new milling machine if your discount isn't half? And how many crowns do you do a year? Anybody here not have dental software? Anybody here still using pegboard filter systems? Okay, makes life easier. So your software system is going to allow you to run a practice analysis. In your practice analysis, you're going to have what you did 1 year to the next. You can go back 3 years. This is from Dentrix. Dentrix allows you 3 years. EagleSoft also allows you 3 years. I'm sure the other plans will do something similar. The reason I'm saying look at the multiple years is because most offices were closed for a great period of time in 2020. But I have the numbers. So again, 885 single or crown and bridge units. Now, if half of those, let's just say just half came from a managed carrier, discount insurance, 442 times 500 crowns. If you're $1.5 million practice, that is 1 month that you work for free. If you're a $3 million practice, that's a couple weeks you work for free. Now the great fear always comes, I hear this from many dentists, but I can't drop it. I will lose my patients. Again, remember, 2 types of offices, 2 types of patients. The drive-by office will always be, there will always be a need. There will always be the person that says, oh yeah, I drive past XYZ, Acme Dental every year, every day, I don't care. I just bit something at lunch, it broke off the side of my tooth. I think I will stop at that Acme office on the way home and just have them fix it. There will always be a need for that. But there's always a need for a relationship dentist, for a dentist who is health conscious, who is biological, who is holistic, who is trained and skilled beyond the average. So use your adjustment summary, your software to run the adjustment summary. I just, for kicks and giggles, put in 2 companies that we do business with. The number of write-offs, my average cost of procedure, and the percentage of my production. If I lost 16% of production, but collected 100% of the other 84% of production, I'm further ahead. Run your numbers, talk about it with your practice, talk about it with your doctor. Talk about this especially with your business team because that's who's going to answer the questions. Your doctor's in the back. He's going to default, he or she just go, oh, well, go talk to Sue up there. Or in my case, go talk to Kristen. She'll explain it to you. So you track your reports, you run it. If you don't actually know another way to do it, this is simple. Look at your payments. Where you record your payments, you should be recording electronic funds from whichever companies they come in, or checks, or whatever. But you're going to have a number in whatever your accounting software is, QuickBooks, Peachtree, something that says where that money comes from. You can easily see the percentage of, I'm just going to say Delta or XYZ, as compared to everything else. And then you decide, you know what, I'm not working a month for free. I'm not even working a week for free. I want to stop doing this. Now, you signed a contract. Go back, dig out the contract. And if you can't dig it out, just Google it. You'll find it online. Check the contract. How much notice are you required to give? In most cases, it's 90 days to the insurance carrier. Some of the small ones I've heard go up to 6 months, but I've never heard anything like with a 30-day notice. So you have a little time. You have to set a date. You have to say, all right, this is March. You go back, you talk about, you say, you know what, July 1st, we're going non-par. We're going to go cash basis. So everybody in your office has to be prepared. As soon as you notify a large insurer that you are no longer going to do business, you know what they're going to do? They're going to notify your patients. So you have a couple of ways to handle this, and I'm going to help you walk through the better school of thought. There's one that says, just send a letter. I've seen this from so many practice management gurus, you just notify everybody. What's likely going to happen with at least half of those? If they don't have a relationship, if they haven't been coming for a number of years, we just go look for somebody else on the list. Now, when we first had a few more managed cares, and we dropped them years ago, they would leave. And this happens too when somebody changes jobs or their employer changes carriers. They go, we don't accept my insurance anymore. No? Well, is there a discount? Nope, everybody gets, same fee for anything. You have to be very careful on how you do this because you do want to inform them. You do need to inform them. The other one is I've heard people say, well, just wait till after they're all done and say, next time I'm not going to have insurance. How would you feel if you were in the chair and this is what happened? You want to notify them, but you want to do it in a kind, respectful way so they know how and why. This is one good school of thought. I've seen this many, many times before. After recare is complete, and this is before you've notified your insurance company, you just start telling them. So the month before, so maybe 4 months before, you're going to say, doctor's no longer participating with your insurance discount plan, but for the next 6 months, he or she is going to honor that same discount that you were getting before. So we give you a transition period. That's a very kind way to do it. Don't change in the middle of any treatment plan. If you have somebody who's in phases and they're maybe in their second phase, it's going to take 6 months to finish them, look ahead. Look at your pending treatment plans and go, okay, you know what, we can't change the 1st of July. We're going to change 1st of September. Pick a date that's out there so you can start gently notifying your patients. Think of how you would want someone to talk with you. And yes, you will lose some for whom cost is an issue, but just like some of those who left our office, they went elsewhere. They went to the guy down the street who takes everything and gets them in and gets them out, and they didn't even know what they had done. And they said, I have my teeth cleaned in like 30 minutes. Like it takes over an hour in your practice. Yeah, that's not really clean. That's a little polish, and that's about it. Makes it look pretty, though, doesn't it? Take a mental break for a second. Think of what your patients are getting input every day. So much information. You tell them the first time, okay, they go home, they forget. You tell them the second time, they go home, they forget. Their brain is going someplace else. So now, oops, I want to back this one up. So now you will need to do it in writing. And I would suggest that you send something out at the same time that you're notifying the insurance carrier. So it comes from you first. And you're going to tell them that we cannot afford to do this. What I have done is I've written a letter that says the doctor will not compromise your care and use cheaper materials and services because your insurance company is asking us to take a 30% discount. It's what you would want someone to say to you. So that's the way that you present it to them after you've had several conversations in office with that target date. So moving on. That works great for dental insurances, discount plans. Did you know that most Medicare benefits now include dental? Whether you signed up or not. So they come to your office. Yes, I am older than I look, and yes, I have been an assistant been in dentistry since 1970. I was dental assistant in the Navy, became a hygienist. So I do have a Medicare card. When my card renewed this year, it said dental and vision. I laughed. Called my agent. I'm not paying for this, my dental's free. He said, no, everybody's getting that. Everybody in the state of Michigan who has Blue Cross and in multiple other states are now getting dental and vision. Really? What do I get for that? Yeah. Sue's from Michigan, so she's in the same boat. Free, right? My dad used to say free as cheese in a mousetrap. We'll think of that one. So what is not covered under Medicare A and B, which is what most people have? Most dental care, except in rare circumstance they have cancer. So there's nothing under traditional Medicare. Medicare Advantage is C. If you need services Medicare doesn't cover, you'll have to pay for them yourself unless you have other insurance or a Medicare health plan that covers them. So look what they did. They gave us one. Plan availability varies by region and state, of course. So I pulled this out of a physician's schedule because I thought, how do physicians deal with it? Now, let's just say, look at your dental software and figure out how many people are 65 and older. You could have patients on Medicare under 65, anyone with end-stage renal disease, with certain other medical conditions could be under 65, but mostly you're looking at the over 65 population. Let's suppose in your practice, good healthy practice is somewhere around 20 or 30%. Yeah, let's see, there's no way you're going to get to 100% because you can't bill the difference if you're a physician. But look at a physician who is a Medicare practice and takes 80%. They have to collect 109%. Where does this money come from? My math doesn't work. You get 100 pennies in a dollar. That's it. But that's what physicians deal with. Do we want to do that? I don't think so. The other thing that Medicare will try and hook you through is DME, durable medical equipment like dental orthotics. If you have billed for Medicare before, or if you have patients that have Medicare and they need to get something covered, 20% co-insurance per item, in or out of network. Advanced plan approval required. Doctors, watch this. The physician or other healthcare provider is required to obtain advanced approval. Otherwise, the enrollee is not responsible for obtaining prior authorization. And guess what? If it's not prior authorized, you did it for free. I don't think we're in the business of doing stuff for free. So let's see what the patient sees. Again, I just pulled this up on my site. Care to prevent or find problems with your teeth and gums. Zero copay. I don't have to pay anything. Cleanings. It doesn't say what type. I might have a perio problem. But, don't worry. It's a cleaning. It's going to look pretty. Zero copay. Oh, they all have plan limits, but I don't have to worry about that. You're the dental office. You take care of it. Dental x-rays. Zero copay. This is what all Medicare recipients are now getting, and it's coming across the country. If it hasn't come to your state, it is. Oh, and you have an MPI number, right? They know you. If you don't opt out, you find yourself in. So let's talk about how to opt out from regular dental Medicaid. First, the opt-out period begins 60 days after you send written notification, and I'm going to show you how to do that. It's good for 2 years. It used to have to be renewed every 2 years. You had to send in another letter. Now it's automatically renewed for 2 years unless you opt back in. You have to enter into a private contract with your patient. It's on the Medicare site. It's pretty specific. And the doctor and patient sign the private contract every 2 years. In our software, we have a pop-up that comes up every 2 years. It's time for them to re-sign. And we have the same form for everybody. My opt-out period starts July 22nd of the, I think it's even numbered years. So every 2 years, I reprint it, and anybody who comes in after that date just signs a new one. And they know. And by the way, they cannot later back bill behind you because that's fraud, and it's in the private contract. So you're clean. If they do, they're in trouble, not you. Did I miss one? Wait a second. Yeah. So eligible to opt out, doctors of dental surgery or dental medicine. if you're an anesthesiologist or an anesthesiologist assistant or a speech pathologist, you can't opt out. You're trapped in Medicare. But yes, dentists can opt out. I've had that happen before. People say you can't. Yes, you can. So opting out allows you to render services under a private contract. So patient pays you. Neither the provider nor beneficiary submits the bills. The beneficiary pays you separately and is not reimbursed by Medicare at all. And the private contract is signed by agreement. So how do you opt out? This is CMS Medicare. cms.gov/Medicare will take you in. That will go to your site. When you go in, this is what the site looks like. You may or may not already have a Medicare provider number. There was a period of time where when you got your NPI, you were already assigned one. Wasn't that nice? How convenient. So you want to manage your enrollment. There's getting started with PICOS, revalidate, withdraw, and opt out of Medicare. That's the button that you click. It's opt out. Even if you say, well, what you want here is opt out. Your opt out screen will start with an affidavit. Depending on where you are in the country, there are 7 different Medicare regions. This is what the Michigan opt out looks like. Michigan, Ohio, Indiana, Illinois, Wisconsin, Pennsylvania. It will be very simple to fill in the blanks. Your full name, I'm sorry if this is not clear, your practice address, email, telephone number, your NPI, your date of birth, your social security number. If there are 3 doctors in a practice, each one who wants to opt out fills this out, not with the practice NPI, but with the individual NPI. License number, state of license, any specialty. Specialty is dentist. We were filling this out for an associate. It kept being kicked back. I put general dentist. They wanted dentist. They called, what's your specialty? It's a general dentist. I wrote general dentist. Nope, it's Medicare. You have to play it by their rules. Do you wish to order and refer? No. If you want to do durable medical equipment under Medicare, you say yes. If you don't want to do that, you say no. The reimbursement to you is the difference. So it depends. If you are doing a lot of sleep orthotics or a lot of TMJ orthotics, consider this one carefully, and you may want to talk to your malpractice carrier who's going to give you some information on what that means for your practice, and talk to your accountant too. You're going to read the rest of it, all the things that you're not going to do. You're going to sign and date it, and then sadly, you mail this in. Sometimes they'll let you fax. They don't use email. It's the government. So if you provide Part B, which is going back to the ones that may have had an accident or cancer surgery, you need to either formally opt out or enroll. Dentists are not required to enroll or opt out for Medicare Part D prescription drug plans. That's a question I get asked often. But if my patient is age 65 and up and I write them a prescription, they won't get covered. Yes, they will. This does not affect that ability. Withdrawing from Medicare, if you retire, you must formally withdraw. Even if you're opt out, you have to formally withdraw. It's part of the security keeping your ID intact. So, can I continue to receive payment for services to Medicare beneficiaries under an Advantage plan? No. Look what happened. All those free services that I was going to get when I came to your office? Yeah, no. Private contract. This is my sample. It's probably clearer on your screen than it is on mine. Medicare gives you the format, tells you exactly what you need to say. Do not change the language. Use the language from cms.gov. Tells you every step along the way what the 2-year period is. You fill in the blanks, you have the form. This is what your patient signed. Now, it does say signature by patient or his or her legal representative, and it does have the name of the doctor and then the doctor's signature. We use the doctor's signature stamp so we can mass produce these or we can have them electronically. We don't have the doctor sign them individually each time. I checked that one out with my malpractice carrier. They were fine with it. Okay, so this is where we're going to spend the next 15 minutes. I was delighted to see all one med here. Last month, I was at SDS conference on the other side of the state and heard a woman talk on Medicare billing, and my brain went numb. Like, nope, we don't do that, we're opt-out. And she proceeded to talk about becoming an oral physician. This is new, folks. This is very big. Less than 1% of all the dentists do this. As an oral physician, you think like a physician. If you are removing a tooth because it's decayed, you're getting to the apex, you're cleaning out the infection. You have to remove the tooth to get to that area and clean it out. Dentally, we say extraction. It's in the mouth, it's not above the gums, so below the gums, it's an excision. Medicare pays, but as an oral physician, this is wearing two titles. I have lots of initials after my name, so in one of you, it's putting on one set of initials versus another. You apply to CMS, Centers for Medicare and Medicaid Services, as an oral physician. You can do this on your own, or you can do it through a vendor. My own experience, I'm going through them because I don't have time or inclination. Yes, you have to pay for that. You can talk to them later if you're interested. But you are now registered with CMS as an oral physician. Oral physicians are important. Oral physicians are essential. Oral physicians were not shut down during COVID like dentists were. Now, you can't do prophies, but you could do a lot more services. You are not shut down because you are essential. Anything under the gums is considered. Anything restorative above the gums is definitely dental. So I have a patient coming in who has sleep apnea, can't wear a CPAP. I need to do thorough diagnosis, and we need to do a cone beam. There is a procedure for that. Now again, just like dental, we have codes, and you may have noticed 2012, the dental insurance ADA claim form changed to have diagnostic codes because they're getting us ready for dental or for medical with dental. As an oral physician, you have a diagnostic code, and then you have a procedure that goes along with it to confirm or deny the diagnosis. When this is submitted, Medicare pays on its fee schedule. Now, let's just say we're extracting a tooth. And in my office, let's suppose it's $200. And let's suppose yours is $200 and yours is $200. And let's suppose that our insurance knocks it down to $150 and then gives us $120. Okay. But Medicare, as this is an excision, that fee schedule is around $800. I could not wrap my brain around this. Like, no. But I don't charge $800. And let's suppose we have husband and wife here. One spouse is under 65, has a dental plan. The other spouse is over 65, has Medicare, and has Medicare Advantage. I've opted out of Medicare Advantage. Took a long time for me to actually keep looking this up and looking it up and looking it up and finding out they're absolutely right. You know how if you accept a different dental plan, you sign up with Aetna, you sign up with MetLife, you sign up with Prudential, and a service that you charge $200 for, one company might allow you to charge $109. Another one might allow $150. Someone else might say $171. Delta might say something else. And you have to charge whatever that amount is. Medicare is no different. Medicare pays medical benefits. So Medicare pays a much higher amount for those services that are applicable, leaving their dollars, their patient dollars left for their dental work. It takes a moment to wrap your brain around this. But it is true, it is legitimate, it is perfectly legal. If a patient comes into an ER or an urgent care center, broken tooth, hit in the mouth with a baseball bat, they look at it, they give pain meds, they call a dentist. They might have a nurse anesthetist there. The center gets paid, the physician who looked at it got paid, the pharmacist who dispensed it got paid, everybody got paid, but the dentist who was called in on Saturday night got $72. An oral surgeon coming in on Saturday night gets paid $84. An oral physician coming in gets paid $800. It is a difference of registering. I know. I listened to this and I went, nope, that can't be. That cannot be. I was walking through the exhibit room. I will tell you they are here. I have no vested interest in them, just like I said before, but I am becoming one of their clients. I have their information here somewhere. It's all one med. They'll explain what they do. You can bill yourself. Sure, you can learn the codes. You can learn how to do it. It is intense. It's just like cross-coding, which we'll talk about in a minute. You may want to look into this. You may want to register yourself. You may want to pay somebody else to do it. It's just something that when I found out, I have to be aware of this. Yes?
Is it only sublingual?
It is anything subgingival. So,
And a Medicare patient?
and a Medicare patient. Subgingival and diagnostic. There's a lot that, so implants are another case. Cosmetic implant. Cosmetic implant, tooth number 8, no. But a patient who's lost an arch or lost multiple teeth and cannot digest their food because they cannot chew properly, remember digestion begins in the mouth, could have implants if you document properly, could have implants because now you are restoring function. It all goes back to restoring health and function. Now, the restorative work afterwards is covered under dental, but this is something that is totally new on the horizon. I shouldn't say new to me. Obviously, this has been going on for many years, and I just heard about it because I never heard about it before. Again, 1% of the dental population. But definitely worth looking at. I started Googling, I started looking up oral physicians. There's 800 some pages of codes in there, and I'm like, oh.
But not Medicaid?
Not Medicaid. This is only for those with Medicare and only for those services that require a dentist to perform that function, that service to perform the function. Okay. Question? Yes. The question is, can someone who is Medicare opt-out, like my office, still become an oral physician? That's what I couldn't wrap my brain around. Absolutely, 100% yes. So you have opted out of Medicare Part A and B, and in our case, we opted out of the DME, and we are becoming an oral physician. Two different departments in Medicare. One they consider dental, the other is under medical. Well, yes, there is additional training. Okay, there is additional paperwork and training, and it's going to be very similar to if you do medical cross-coding. So let me just move ahead here. This is like a reimbursement. I'm going to skip this one. You've got it in front of you. You see how that works. So medical cross-coding. Medicare oral physician is going to be very similar to doing medical cross-coding, but much faster. Medical cross-coding will take care of accidents involving teeth and oral cavity, some airway issues, including breathing disorders and the inability to wear a CPAP, and biopsies, some oral cancer exams, and some cone beams. To bill medically, to bill medical cross-coding, you would want to take an all-day class. You have to learn the diagnostic codes. Your doctor has to start with SOAP notes, which I hope all the doctors are doing, but if you're not, subjective. Patient is here today, says everything's fine, it's my regular checkup. Patient came in today saying upper right side just aches all the time, especially when they bend down to tie their shoelaces. Patient says, I broke the side of my tooth off eating popcorn last night. That's subjective. Objective, doctor says the doctor needs an x-ray, x-ray shows translucency, vertical fracture, whatever the doctor sees. And then the plan, what you're going to do. Medically, that's how physicians write up reports. So this is how the oral physician will write up the report, the same way you would for medical cross-coding. Once you have the documentation, there is a submission just like there would be for dental. Again, I'm personally using an outside vendor because I don't have time or talent or brain space to learn how to do this. It depends. You might have someone in your office who's a real go-getter and says, I can do this. I can do this. Oh, on medical cross-coding, we bill from our office, but our patients pay us up front, and then they get reimbursed. Sometimes it takes up to a year or two, especially after auto accidents. Medicare pays relatively 4 to 6 weeks. Yeah. So something else on going back to medical insurance. I don't know if we need a CAQH to build Medicare as an oral physician. A CAQH number is a bridge between your dental NPI and the ability to reach to a medical insurer. CAQH number, if you don't have one, if you do have one, count yourself lucky. If you do not have one, now requires an ADA membership. We went to do this. I'm like, no. My team told me last year, no, we have to be an ADA member. Not happening. Totally up to you if you want to or you don't. But in my world, I didn't want to. So we talked about that, and I tried a roundabout way of doing it. Nope, no workaround. You now have to go from CAQH to the ADA site. However, it didn't say you had to be a continuing member. We got the number and we dropped. That worked for us. So if you do need to have a CAQH number, that is something to consider. And again, have your patient pay you first. So that's the formal part, and I know that this takes a moment to sink in and digest. It is a way to replace the lost dollars that would otherwise be gone if you lose patients. It does also separate you because as an oral physician, this would be on your website, this can be on your Facebook page, and patients will say, well, what does that cover? Well, there are some instances where, the same blood flows all the way around your body. Your saliva gets swallowed into your digestive system. There are cases where what you perceive as dental is actually medical. So we work with both so that we bring the best to you. So questions? Yes? We do soap notes on all patients, including, the question was, does our doctor do soap notes? Every clinical person in our office knows how to do soap notes. We start with a template, S, patient says, and then they fill it in. Usually the assistants do that, even our hygiene assistants. O, doctor says or hygienist says, and it's by name, which doctor, which hygienist, their findings. A, their assessment. They want an x-ray, and then P, their plan. So yes, we have done that all the time. If you are on Dentrix or EagleSoft, there's a template for that. If you're on one of the others, I'm sure all the other software companies are doing the same. You're all looking at me like, this can't be. I said that. I said that for a month, and I looked it up, and I was like, I'll be darned. This is true. We are just signing up now, so we have not done it. They have examples, and they have all the information for offices that have. I will tell you, just like anything else, when you sign up for a service, there's going to be a percentage charge to do it. I mean, let's face it. If you used a billing service back in the day to file your dental insurances, there was a billing charge. So, you always bear that in mind. But if you're getting that type of help for your patients, and I think of the implant patient, as we are as an aging population, what do people want? They want teeth. They don't want dentures. So if you have a way to help them get that, if they do have dental benefits, they can save them for restorative. If they're paying out of pocket, they're paying for restorative. But you have definitely greatly helped them. Okay, anything else? So, that is the Medicare Advantage plan. In Michigan, Blue Cross has offered all So you can get Medicare as a standalone. Most of you are a lot younger. When you turn 65, you have 3 months before or 3 months after to accept Medicare. If you don't, there is a surcharge down the road. So it's a hospitalization plan and a medical plan. Blue Cross of Michigan, which actually encompasses about 6 other states, will now give medical and vision care to everyone with Medicare. Is the Part D plan. So if you haven't opted out and your patient later says, hey, you know what, I talked to my insurance person and they said that cleaning is free. And so is your checkup. And I think I had x-rays too. If you have not opted out, you are subject to their plan. So if you want to do that, opt in. If you don't want to, opt out. But in either case, you can become an oral physician, which, again, different department. Think of Centers for Medicare and Medicaid Services, 2 hallways. Dental branch, medical branch. Medical branch is oral physician. So the question is, can you always opt out? Just like regular Medicare, there is a way to opt out, and there, again, is a waiting period. So if it takes 90 days to get in, I'm going to bet it's 90 days to get out. I don't know that for a fact, but yeah. Question?
So now you have a patient who came in for the checkup and says, my cleaning and exam and x-ray should be free. And you've already told them that you're going to send off for their vision.
Yes. So,
How do you rectify that with the patient?
okay, patient has Medicare Advantage, thinks that all these services are free, and rightly so they may be if you have not opted out, but medically you would be still sending in for an excision, and in order to get to the site of the infection, you have to remove the offensive foreign body, which is the tooth. Yes, you could do both.
And then if we have opted out, so we, of course, pay up for your exam, cleaning, your preventive visit.
Yes,
And yes,
yes.
medically,
We can take care of this, of removal of this tooth and the excision that follows to clean out the infection. Now, opting out of Medicare, your patient will know this in advance. If it's a new patient calling on the phone, do you take my insurance? Do you take whatever? I've got Blue Cross. That's what they say. I've got Blue Cross. Yeah, well, that's your medical card. You've got an Advantage plan. We're going to look them up right then and there. We're going to say what they have, and we're going to tell them you have an Advantage plan, and we do not participate in Medicare. So you will sign a private contract when you come into our office, and you're going to continually sign one every 2 years. We have this set up so that we can treat you with the best materials and the best services. If they start asking questions, we just go on. We do not compromise in quality just because you have Medicare. And that usually sinks in very quickly. And once you do decide to opt out, you're going to do the same thing as leaving the insurance company. You're going to start explaining to your patients that you've opted out of Medicare. You formally opted out because of all these Advantage plans, and we're not just going to do, in my neck of the woods, we call it half-ass work. We're not going to compromise your care to do just what they pay for. That's why we don't take all the little insurances either. Okay. Usually you keep taking it back to quality of care, and they understand the difference. Okay. Yes. Good question. Do we assume if we don't know that you are in? Yes, because Medicare, ever since NPI numbers have been around, Medicare has those. They're in the government system. They know who you are. In many cases, if you have not opted out, you are in. And I have had this portion of the talk over the years, over half a dozen years or more, with people who went, oh my gosh, you are right. I did a 3-unit bridge on this person because, you know, they were missing one tooth on the other side, but you know, but this was a molar. They wanted that first molar replaced. I did a 3-unit bridge, found out they had Medicare, and Medicare would only cover a partial denture, and I couldn't charge to pay. I had to give the patient money back. Yep. So So you do want to be very careful, especially with the Advantage plans coming automatically. I know it sucks, but welcome to more stuff that you need to fill up in your brain. Another question. Okay, best way to find out what is going on in your own state is, one, you can check with your department, with your insurance commissioner. You can email them. That's the fastest way to get the answer. Second is call your malpractice carrier. Most things I default to my malpractice carrier because they're the person that I would have to talk to if there was an incident. So that's who I'd ask. No. So here's the way that we did this. We opted out over 20 years ago, the first opt-out. Our associates came in, they opted in, we opted them out right away. When we first opted out, we just told patients as they came in, we don't take all the different carriers. We don't participate in Medicare. And with that, I did not send a blanket letter. But it is on our website. And if you look for it, you can't find it easily on Facebook, but it is on our website, like who and how we participate with. So no, you don't have to send a letter. You just, when they come in, you go, just to let you know, we have opted out of Medicare. They restrict us to what type of fillings. We don't do silver mercury fillings. And so we don't want them dictating your care. Question? Yes. Good question. If you opted out years ago, do you know if you're still opted out? Yes. If you didn't do it continually, and it was a 3-year period at one point, then it went to a 2-year period, the easiest thing to do is look for a Medicare dentist near me. Just put that into a search bar and look up your name. And if you show up, you're in. Kind of sneaky, huh? All right, I'll take one more question if there's one more, because then we're at the end. All right, thank you.